First of all, it's having the right board members at the table to make the critical decisions they do about the public's health. So are they from diverse backgrounds? Do they have diverse experience? And are they from diverse parts of the state or country in your case? So that's the first thing.
The Oregon Medical Board is an organization that is self-funded and not regulated by a state-appointed or elected official. Its funding is derived by the fines it levies on doctors facing allegations of misconduct. Although the OMD follows guidelines that are legislated by the state, it isn't answerable to any government body. Doctors who are accused of misconduct can appeal the OMD's decision through the courts, but are discouraged to do so largely due to the cost involved, as well as the emotional investment which often takes its toll on the doctors and their families. There's a growing concern that the discipline of doctors satisfies an administrative agenda. How do you think this affects the doctors and the public by and large?
I went into medicine to help people. The medical board has made decisions to revoke my license 7 years ago. The most significant stressor is probably the fact that it's very difficult to talk to people about this. Number one is they really don't care to hear it. Number two is it's very complicated, and to capture someone's attention for a length of time, to explain it to them is very difficult.
What happened with Governor Kate Brown?
Kate Brown. I've sent multiple letters to Governor Kate Brown asking for her to intervene in the Oregon Medical Board and other healthcare boards regarding how they're attacking licensees and how the licensees are not given due process. They have no constitutional rights. And her office responds with, at the most, a form letter, if they even respond at all, basically saying, thanks for your input, we'll take that into consideration. There's no politician except for one has ever invited me to speak with them. None of them have questioned me. None of them have asked me for any further records, and certainly Kate Brown never has, and she seems to have no intention to ever do that.
What about your state representative or your congressional representative?
I spoke to my state and representative and senator, and neither one of them. Well, the state representative spoke to me at length on the phone, but there was no follow-up. He seemed unconcerned, and as did the senator.
So you were fobbed off, basically?
Yes.
Tell me more about your colleagues, doctors that you've known throughout your years of practice. What was their, how did they respond to this, you losing your license?
It's something I kept pretty private. I didn't really feel like going into a lot of detail just because everything's so complicated. There's so many charges and accusations, and none of them are true. But to try to explain that to folks is very difficult. And that's why I set up a website, so that could all go up there. I could plead my case, show all the evidence, and then people could see exactly what was going on if they were interested, instead of me trying to explain something to them and watching them go starry-eyed. I found that it was quite useful for folks that had chronic illnesses of different sorts to utilize medical cannabis and get away from drugs like opiates, psychoactive drugs, muscle relaxers, things that were not helping them, but certainly clouding their conscience quite significantly. They did come after me because of that. I'm absolutely convinced. There was no reason to revoke my license. Even if they were upset about the fact that I was helping these patients, they could have told me, Dr. Dover, we don't want you doing this anymore, or we want you to do it this way instead. They did not have to take my license. They never gave me a chance for anything other than going to a hearing. They recommended that I go to some $10,000 course so they could evaluate my medical knowledge, but that they basically had already planned that they were going to take my license. They don't like to be challenged. If you stand up and demand your civil rights, or if you say that you have due process due to you, they don't like that. They want you on your knees, and they want you acquiescing to anything that they state.
And it's not just the doctors who qualify in Oregon that may bear the wrath of the medical board, but doctors transferring from one state to another.
I was told that this was not something that just happened to me, but they really do not like out-of-state people coming in. And it turned out that it was so pervasive that I was called up to speak to a House subcommittee because some of the things that the boards were doing were so outrageous to keep out-of-state people in. For example, even though they should have had reciprocal licensure from another state, like in my case, they said, no, you have to take the orals here. When the psychologists go to take the orals, what they were doing is they had a 3-member board who were supposed to be psychologists and to give the questions. And what they were doing is they had the non-psychologist members of the board sit on, and the 2 psychologists would pass the psychologist and say, yes, they answered the questions correctly, they are licensable. And the non-psychology member, who happened to be an attorney in this particular case, he would say, I do not like their theoretical orientation, and fail them. And it only takes one of the 3 members of the panel to fail. So that was one of the little dirty tricks that kind of led me into becoming active and testifying in front of a House subcommittee. And when I finally moved here, I took a position and I moved here, and I thought, well, if I have to, I'll just drive down and get the form and pick it up. And when I finally called the chairperson of the board, and I said, I cannot get this simple form. Please, I'm here, I've accepted the position, I've moved all the way to the state. And she said, this did not happen. This did not happen. And she said, Dr. Miller, if you don't like how we do things, you can go back to Wyoming.
This ominous-looking building without any plaque or sign outside telling us if the Oregon Medical Board is indeed situated here happens to be the Oregon Medical Board. We invited the OMD to be interviewed for this documentary, but our invitation was declined. At every turn, any attempts to contact the OMD was rejected, both in person and in writing.
The first time I came to the medical board's attention, that came out of another event, and I initially cooperated with them and did what they asked me to do, and they still came back with a reprimand. So I took that to the State Court of Appeals. It was overturned in my favor, and at that point I thought the board and I were done. Then a false allegation occurred, and they had me on their dartboard. So
once you come under the purview of the board, it's to the slaughterhouse one way or another.
Exactly. Once they get one physician in their sights, they just don't let go. It's not an objective process. It's a completely subjective process where we think you're a bad guy and we're going to get you, and we're going to do whatever it takes to do that. And they will go behind your back. They will talk to, like in my case, they would go to the hospitals and talk to my patients without talking to me first. If they at least would have talked to me first, I asked them, I said, look, if you're going to go talk to the hospital, tell me, and I'll tell the hospital you're coming to talk to them. This is what you're going to be talking to them about. I tried to be transparent with them. They are not transparent.
They were less concerned with how your treatment towards patients and more concerned with your treatment towards...
They have fully admitted that I'm a good doctor. It's a facade. They really have a completely different agenda. It's to keep physicians in line in their philosophy, that they have to, this cookie cutter view they have of what a doctor should be and how they should act and how they should think. I practice pretty much along standard clinical lines. I'm not a out of the box practitioner. But over history, we've needed those people, right? Medicine wouldn't have advanced. Maybe in the research setting, I could be a little bit more that way. But my mind's not framed to, integrate. I'm very skeptical a lot of times. I'm very, scientific minded, and versus other people who might be a little more open to other things. And those people I know come under kind of for the same reason. The board doesn't like that. And they don't but from a personality point, they don't like me because I'm not of the standard type personality that they want to see.
As already highlighted, it appears that the OMD is less concerned with medical procedures and possible malpractice by doctors and more focused on maximizing their cash pool. We obtained records showing that the OMD seems to be hitting a target of around 150 doctors receiving fines. That's per annum. The doctors never see the complaints, nor do they see the documentation emanating from the complaint.
It's an economic thing. They want to make sure that the money keeps coming into their cash registers. And so I got targeted when it was found out that some of my patients were using natural substances. In Oregon, we have something called medical marijuana, as in many states, and I would occasionally see patients under what was called the Oregon Medical Marijuana Program. And one of the particular patients that I saw, he had been abusive of some bad drugs. But the program allowed for use of medical marijuana for a set of diagnoses that you had to examine your patient and determine if they fit that criteria. And so I did that, but what had happened is his other doctor in an adjoining town felt that I was doing something wrong, that I shouldn't have given him the certificate or the attending physician statement that said he qualified for medical marijuana. And so that was the first time that I got in trouble with the medical board, as they called me in to interrogate me over this particular patient, and saying that I shouldn't have done this or that. But it was never anything I saw in writing. I never saw the documentation. I never saw the letter of complaint, nor did I see the name of the individual who complained, because it wasn't the patient. He was perfectly happy.
So even though you followed the guidelines and the law of the state,
right,
they still wanted to come after you and penalize you?
They saw it as a way to investigate me, and I think that if they can investigate you, they'll find something. They'll try to find something. A young lady that was my secretary, who later became my wife in 2007.
So they abandoned the marijuana?
No, they didn't even talk about that anymore.
Oh, I see.
That wasn't important.
It was superseded by a complaint letter from...
And as we all know, medical marijuana has become quite an article now in the state of Oregon. I mean, now you can get it recreationally, which I'm really not a big fan of that. But
had your secretary been your patient, in fact? Was she registered as a patient with you? She
had an examination for the standard introducing a patient-doctor relationship, yes, and I did blood tests for allergy and gave her a vitamin IV.
Is there a law in the state of Oregon prohibiting a doctor falling in love with a patient? I
think it's totally discretionary.
I see.
But there has been more of an effort to discourage it. I took my case to the medical board. They said that I was fraternizing with her, and they made some other allegations because of my alternative interests against my staff, who were phoning in occasional medical prescriptions or testing people using kinesiology, and we used provocative neutralization, which is another alternative approach that they didn't like. And so when I was finally called in It was in fall of 2009, before the administrative law judge. They presented all this evidence, which basically we refuted to the satisfaction of the administrative law judge. But they told the administrative law judge when they issued their final statement, their final order, that the administrative law judge got it all wrong, that I wasn't suitable for just a suspension of, say, 3 to 6 months, that I should have my license revoked. And one of the most interesting points was they based it on these emails.
And had they subpoenaed those emails? How were they privy to
They
them?
coerced those emails out of my then wife's half-brother. There was no due process. There was no equal protection under the law. They just flat out said that I lied to them because what I tried to do was ignore the fact that I had these private conversations by email with her. I guess if you're Hillary Clinton, you can get away with that kind of stuff, but I didn't.
And yet the original accusations about you regarding the marijuana were never even mentioned in the...
Absolutely none of that was mentioned. That was totally forgotten.
So it seems that they acted upon very little evidence, if none at all.
If none at all, and in fact a lot of it was fabricated and is distortion and exaggeration.
And how long did this go on for?
Well, that was a 2.5-day affair for which I had been sent a bill of costs of close to $35,000.
What was this bill of cost for?
For my prosecution. So I have to pay for my own prosecution. And a fine was included in that.
Do you feel at this particular juncture that the medical board does this to doctors, brings them up on charges before them and prosecutes them, so to speak, simply so they can give them a bill?
The medical board is self-funded. So the answer to your question is yes.
Do you feel that this is a corrupt organization?
Absolutely.
Are you interested in getting your license back?
I would very much like to have my license back and restore my credibility and my integrity in the community, because I've never had a malpractice lawsuit as long as I've been practicing, and so there's no one out there that was ever disgruntled with my care.
So you very much feel that in this particular case the medical board has intervened, if you like, or spied in on your private life and has used that as an excuse to evaluate you professionally as a doctor?
Absolutely. That was their main modus operandi.
Do you feel that the Oregon Medical Board attempted to make an scapegoat out of you?
I very much feel that the medical board, the Oregon Medical Board, was extremely harsh with a kind of, so to speak, punishment or that was given to me. My issues normally when doctors are reprimanded or receive a some sort of a punishment, so to say, it's usually due to any patient harm. In my case, there was none. It's usually due to a patient complaint that leading to patient harm. In my case, there was none. And it was usually due to a malpractice claim. Mine was none. And due to an impairment issue, drug, alcohol, issues, or pain medication addiction, that sort of thing. In my case, there was none. It's usually due to a insurance fraud or criminal charges of some sort, a DEA, perhaps, illicit use of drugs or so forth. In my case, there was none. It's usually due to a sexual predator or some sort of a sexually offensive situation. In my case, there was none. Maybe a sexual harassment. In my case, there was none. I'm still to this day trying to think what was so severe that I could not have been given a fine or some sort of a so to speak, a punishment that, aside of being revocation, when you revoke a doctor, it means that they're harmful to practice and treat other people. I had none of those complaints. What were their guidelines?
There is a common theme among some of the doctors we interviewed regarding how the medical board punishes doctors once they've been accused. Whether the board is subservient to the pharmaceutical drug companies or totally acting on its own accord is a matter for further investigation. But we've come to understand that there is a link between why doctors are penalized and the relationship between medical boards and the big pharmaceutical companies.
I practiced outside the box. I was not a standard of care physician. But as William Osler, they quoted me during the hearing as saying a lot of quotes about William Osler. They forgot one quote. William Osler said that be also very careful about how you give drugs and about pharma. And I rest my case there because I strongly feel that had I been a conventional doctor that just practiced standard of care medicine, I would not have had a revocation.
How do you feel the pharmaceutical industry plays into this type of mentality?
I think the pharmaceutical industry is a very, very big lobbying group, and I'm going to give you an amazing example of this, okay? And I think everybody will be able to understand it. And again, check the facts out because I only will give you I'm only presenting factual information. The Federation of the State Medical Boards was investigated by the Senate committee, and this is a true fact, in 2012 for receiving a check from Purdue, which was a pharmaceutical company that was making OxyContin or the pain medication.
That's right. Yeah.
Dr. Fishman was given an award, and he represented the Federation of State Medical Boards and was given an award by the Federation of the State Medical Boards for having for giving the guidelines, for making a booklet. Now, when that booklet was dissipated to all of the state medical boards and then became standard of care to teach to the doctors of guidelines to follow, okay, it was years later that they learned that the oxycodone or OxyContin, the long-acting pain medications are actually very harmful and could lead to severe addiction issues. And so suddenly, when the Federation of State Medical Boards were investigated, they immediately responded by saying, "Oh no, we're going to get the doctors who are doing all this prescribing." They did not want to take responsibility for setting those guidelines. They wanted to wash their hands, totally wash their hands of it, and again blame the doctor. So the doctor is stuck both ways. The doctor is stuck trying to do the standard guidelines, but if let's say they get investigated for the wrong standard guidelines, then he's going to have to change. But by that time, he'd already prescribed these medications to which many were addicted, and so he was stuck between his patients begging him to try to slowly get him off. And now we have a dilemma of people who really do need pain medication and are not being given pain medication and are being made to suffer because of these new guidelines that are now telling everybody to get off pain medication because opiates is such a huge thing. So what I'm trying to say is that, yes, the guidelines that the state medical boards are based very much so on a relationship with a pharmaceutical, and that's a very powerful relationship. And if the state medical boards and the Federation of State Medical Boards is a nonprofit or does not represent any interest, this is a total conflict of that.
So what you're saying is that it's a moving goalpost, if you like. On the one hand, the state wants you to prescribe the medication that the pharmaceutical companies are making, from which they're receiving money from their lobbyists. But on the other hand, if something goes wrong with the medication,
it's a doctor's fault.
They chase the doctor for it.
They chase the doctor, and that's how they get out of it. So, and I think for the doctor to be living in fear, there is an increasing number of doctors that are suffering from depression, from anxiety. They no longer want to lifelong become a doctor. There's a dropout rate like anything. No one is going through the entire career. Remember the beautiful days about how a doctor read about an interesting case and then went on until they were 80 years old. They were practicing. They were still called upon to share their wisdom with the younger students and teach, and the beautiful interaction. It was an art. There's an art of medicine. We no longer are practicing an art of medicine. To me, and please, I know this is a very strong statement, but I feel it's a very true statement. I feel that the pharmaceutical companies are pimping the doctors right now, and I would never use those words. It pains me to even say that, but you cannot have a healthcare system survive when the doctor is living in fear because they're not following this standard of care of medicine.
Do you feel that perhaps they came after you partially because you were successful at what you were doing? Would you consider yourself to have been successful in the way you were practicing medicine?
I was absolutely very successful, and I still, thankful to this day, I still am, because I was, at that time, I had gone into a field called nutrigenomics, which was, the study of nutrients, like pharmacology, and it was a science of studying nutrients. Nutrition and medicine separated. Back in the 30s, we went to the home nutrition, and Jeffrey Bland and Bruce Ames and many biochemists, leading biochemists, brought it back, a field called nutrigenomics, which really just burst, and it has exploded. I went to one conference, I remember, when I was 20 years of age. Now I can't even keep track of the conferences. So we know that that field has exploded. It's all about epigenetics, diet, lifestyle. And I was in the heart of it and learned it very well, and I started applying it. And I can't tell you how many clients I had in waiting rooms waiting to see me because I was practicing this sort of medicine. And I was minimizing the medications. I wasn't eliminating on a lot of them, but I was definitely minimizing or mitigating the side effects. And some of them didn't even need medicines altogether because we changed the epigenetics, lifestyle, and diet through
and of
it, right?
course, pharmaceuticals are not keen
there
about
you
lifestyle.
go. Now we're getting to the issue. So pharmaceuticals are not keen. So absolute, and I was at the time also the Olay ambassador. I was representing a multi-billion-dollar company, Procter & Gamble, and believe you me, they were vetting me out every single day. I don't think they would have me with no credibility representing a multi-billion-dollar company. And when this happened to me, I was just ending my contract with them. So yes, I was very successful in practicing integrative doctor, and they wanted to make a point. They wanted to let every integrative doctor know this is what's going to happen to you if you practice in integrative medicine.
Right.
If you dare to become well known in it, if you dare to become, well versed in it. So a lot of the doctors who actually practice are kind of under they're under low key. They were not as they were under the radar. They weren't as visible. They weren't talking about things that were so great. I was accused of self-administrating testosterone. They took it out of context because the testosterone that I represented, bioidentical hormone replacement therapy, which Suzanne Summers has done a beautiful job bringing into light, yam-based creams, and no one in the state practiced it. I even, in fact, checked with my board that if I could, if that self-prescribing was against the law. It was not. And because they couldn't find any real evidence on me or something which we talked about, those right? All those issues.
The whole point was that you were being innovative and that you were
absolutely
acting outside of the circles.
I was acting outside. So they tried to take things out of context during the hearing, and I have 150 pages of things on the internet people could find on me that make me look like I was a pill popping doctor when I was taking people off the medications, or accusing me of things that really were not even, they were not true, and they were taken out of context. Unfortunately, my profession, and I'm sad to say, that integrity, that spirit of the art of medicine, which Hippocrates, right to the way of William Osler, all our philosophers that were doctors and scientists have led us to believe that this was an art to be blended with science. We are just becoming now salespeople. You said the absolute truth. And this is where I strongly feel, and the whole purpose of me coming out and doing this documentary is because we have had a financial revolution. We've evolved into, now we have cryptocurrency, we have blockchain technology, we have amazing, technologies there. We have the iPhone, and that has led to a beautiful, technology revolution. And yet there's been nothing but our help. Procter & Gamble, when I was their ambassador, and I was asked to represent their skincare line. Do you know what I asked them? It was a surprise interview. I said, why are you taking a person? I'm an anti-aging expert. I'm an integrative doctor anti-aging expert. I'm board certified in anti-aging regenerative medicine by the AFRM Academy. It's not a recognized specialty. Why are you taking me over a dermatologist or a plastic surgeon? They said, the next $1 trillion is going to be spent on people trying to heal themselves to wellness. And why is that? Because our system, conventional system, is failing.
The system is broken.
The system is broken because even though we've got a great system for when you actually have an acute illness, you need a surgery,
Yes.
you get a great technocrat doctor,
Yes.
it's great. But what about the rest of the, what about the aftermath? What about the care? Where is the first integrative hospital? We have none. And patients and clients and consumers are begging for this kind of medicine. Before having a medicine as the end stage,
Yes.
what else could we implement? We have now, JAMA has finally, it got published in the JAMA, that diabetes is a diet and lifestyle. It can be cured with diet and lifestyle. Do you know how much I fought that? People were still, it's a disease. But you can't see it under a microscope. Yes, you can see final effects of it at the end of the day, but it's a curable diseases. Why do we have diseases now that don't even have a standard of care names? We have environmental toxin exposure. Does conventional medicine address the fact that in Johns Hopkins, the Tender study said 1 in 6 children are being neurodevelopmentally delayed due to environmental toxin. And yet, when children present with all these symptoms, push a pill, push a diagnosis. If there's no diagnosis, just wait. Or if there's anxiety, which many environmental toxins can lead to us feeling anxiety and so forth, send them to a psychiatrist, get on medication. What kind of a society are we becoming?
Instead of changing the environment to better the population, just
Absolutely.
give them the medication.
Absolutely. Where are we coming? Is pharmaceutical company become the new dictatorial? And once we control our health, what does that lead? There's nothing else. Anyone who has control of our health and our health records, I don't want to say any more. There's nothing more that can be said to that.
The hand that rocks the cradle rules the world.
That's right.
Okay. Dr. Susan Haney's experience was particularly odd. She suffers from asthma, and the medication to control it causes her conduct to be impaired. After one of her sick leaves, she discovered that the medical board wanted her to have a psychological evaluation.
I'm a residency-trained, board-certified emergency physician. I've been in Oregon my whole life except for the 10 years that I left the state to get my medical training. So, part of the investigation was going through all my medical records.
That's right.
Part of it was having me go through a forensic psychiatric exam. And at the end of it, they modified their addiction program to make it a mental health program to monitor me. Only problem was they didn't leave out the addiction component. Because it's such a fundamental part of their program, they made me go through an outpatient addictions treatment program. Mm-hmm. They said it was because of the group therapy and that it would be good for me and that just everybody in the program has to go through that. But it wasn't my problem. And I went through it just because I was told that was the only way that I'd get back into practice. I paid $5,000 out of pocket. I went to meetings where I prayed to a God I don't believe in and said things that I don't believe, because if I didn't, I would lose my medical license.
Were you told to swear on the Bible or something? Is that what you mean?
Told to pray. I had to say the Lord's Prayer. I had to go to meetings in churches. I had to quote the 12 steps of Alcoholics Anonymous.
And this was enforced on you by the medical board?
Yes.
To attend church?
Yes. Which is illegal. And that was one of the things that made me finally say, this is ridiculous. I got to get myself a lawyer. I talked to the other people in the group that I was attending. They couldn't believe that I was forced into this program. And basically, they helped support me and commiserated with me, but they weren't like me. And I wasn't like them in that respect.
Do you feel that the investigative board, the investigative panel, which is part of the medical board, that you said were mostly It's not something that's known to most doctors.
Correct.
That the investigative panel is actually made up of ex-policemen.
Correct. Also that the executive management are lawyers and not doctors. My first letter to the executive director of the medical board was to Dr. Haley. I didn't know. I didn't know that these non-medical people were actually making medical decisions for me.
So she wasn't Dr. Haley, she was just Miss Haley.
Correct. Correct. And in addition to this program they made me go through, they interfered with my medications. I just started asking around to find out if this problem was more widespread than just with me. And when I found out that it was, and when the medical board was repeatedly threatening me if I didn't go along with everything they said, about a year into it, I finally got a lawyer. I also complained to the federal government, U.S. Department of Health and Human Services, Office for Civil Rights, for the medical board violating my rights under the Americans with Disabilities Act. They were forcing me into a program that wasn't the right fit because they didn't have a program that was the right fit. And I felt the program that they put me into was burdensome, objectionable, and harmful.
And how much have you financially invested in your ability to keep your license and practice?
$500,000
to date.
to date.
And this was all paid to?
This was paid to the medical board for their legal fees, to my lawyer for her legal fees, to the monitoring entity for a monthly fee that they charge, for random drug testing. I don't have a substance abuse disorder, and yet they keep me in the substance abuse disorder program. Why? I have no idea. I've had...
Do you feel that they're just doing this to kind of just get money from you?
Yes. Yes. And I think that by suing the medical board, as I did a couple of years after this started, I was in court with them for 5 years. I cost them a lot of money, and I cost them a lot of hassle. I don't think that the management at the medical board would be unhappy at all if I was forced out of practice because of this. By imposing additional burdens and additional costs and additional barriers to getting a decent job, it's hard to survive in this profession.